patient selection process. Transplant center selection criteria. Every transplant program has specific criteria that guides the team about whether you are an appropriate candidate for transplantation. General center and program-specific guidelines that you are sick enough and you fulfill the acceptable standards to receive a first-time heart transplant or a retransplant if needed. All medical and psychosocial factors reviewed during your evaluation process are considered by the multidisciplinary selection committee. Transplantation may not be appropriate based on current medical or psychosocial factors that may reduce your chance of survival or the overall success of the heart transplant following transplantation or retransplantation. Transplant center selection criteria. Patients can be reconsidered by the selection committee if previous issues are improved or reversed as outlined by the committee and meet program selection criteria guidelines. You have the right to request a copy of our selection criteria. If ultimately denied by our committee, we can forward your records to other transplant programs if you wish and request their consideration on your behalf. Other centers have their own selection criteria and may require a full evaluation with their program prior to making a decision. Transplant Selection Committee is made up of members of the transplant team from all specialties. Your in-person team member consultations are discussed, held weekly on Friday mornings or more urgently if needed. Your case will be presented after all or most of your test results are available. You will be notified by phone or in person of the outcome after your case is presented to the selection committee meeting, or if further workup is required. Transplant Selection Committee. The outcome of the selection committee meeting could fall under one of four categories. Early, transplant is not needed at this time, and you will be followed by the medical team. Accepted, you are approved to be placed on the waiting list. Represent to committee. Additional testing required to make decision. Denied, transplantation is not deemed appropriate. Transplant Selection Committee. The selection committee will also determine what surgery you require and any other procedures or special circumstances. Whether you require another organ transplant in addition to transplanting your heart, for example, a liver or a kidney, any pre-surgery treatment required for elevated antibodies, any testing or consultant follow-up required by the committee while you are on the waiting list. If on the waiting list for 1 year, some repeat testing will be required and your case will be rediscussed with the selection committee. Non-medical factors that may exclude you from transplant. Factors that may exclude you from receiving a transplant. You do not want a transplant after receiving more information about the process and requirements. This is your right and your decision. Active tobacco, drug, or alcohol use. Lack of a support system or resources to be followed at UCLA following transplant. UCLA requires a primary and a secondary caregiver after transplant. UCLA requires someone to drive you to appointments for 6 weeks or longer following transplant, as you will not be allowed to drive yourself. Local housing will be required for those living a far distance from UCLA. Removal from the waiting list. Once you are placed on the UNOS waiting list, there are factors that result in your removal from that list, including but not limited to: your medical condition improves and treatment is not needed. Your medical condition dramatically worsens and your doctors feel you are too sick to survive transplant surgery. You are non-compliant with medical instruction or follow-up. You request to be removed from the waiting list. Your transplant team will have multiple discussions with you and your family prior to ever removing you from the waiting list. Non-compliance. Your candidacy for transplant can also be denied due to documented past or current issues with compliance. Compliance refers to taking your medications as ordered, scheduling and attending your appointments, completing the required testing for maintenance while on the list and following transplant, abstaining from substance abuse, and communicating with your transplant team as instructed. This is taken into account during the selection process. You and your support network are responsible for following the medical instructions of the transplant team. Non-compliance. If you are having problems meeting the requirements for your medical care, your transplant team, physician, coordinator, social worker, and financial coordinator can connect you to the appropriate resources to assist you. Your transplanted heart can fail due to non-compliance, and this will be viewed negatively by the team. Please do not be afraid to discuss any issues with the team that may affect your health and the success of your transplanted heart.